Welcome to this video about implementing specific interventions for pupils and their families to reduce EBSA, part 2 of 3. Using a CBT approach. Cognitive behavioural therapy, CBT, is designed to help individuals through a process of self-discovery to consider alternative ways of thinking and acting using a range of cognitive and behavioural techniques. This aims to empower the individual by providing opportunities for them to experiment and take an active role in the problem-solving process. CBT has a robust evidence base and has proven to be an effective form of intervention for use with children and young people. The time-limited, goal-orientated and flexible nature of CBT is well suited to use within schools. Key concepts of CBT in very brief. Thought patterns are believed to form the basis of behaviours. Therefore, by challenging unhelpful cognitions, an individual can be supported to develop healthier responses that support emotional well-being. Thoughts can be described as helpful or unhelpful. Helpful thought. A helpful thought that takes into account presenting evidence. This often involves rational thought patterns, weighing up the evidence, and being realistic about your ability to manage situations. And unhelpful thoughts. A thought that could be unrealistic and not based on factual information. This may involve jumping to conclusions, the worst case scenario thinking, and underestimating your ability to cope with situations. An example of a CBT technique. There are many different CBT-based techniques that pupils can be taught in an intervention. One common example is teaching the pupil to track and challenge negative thoughts that they have about school. Verbal and written activities using a variety of forms typically include questions such as, is this a fact or is it an opinion? What is the evidence that this is true? What is the evidence that this is not true? What is the worst that could happen? Could I cope with this? What is the best that could happen? How would I feel? How have I coped with similar thoughts before? And what would I say to a friend if they were experiencing the same thoughts? Another example of a CBT technique. Another common technique is to help the pupil to face their fears about school by using graded exposure in tandem with other coping strategies. The core goal with this approach is to gradually expose the pupil to something in school that they are avoiding, to gradually reduce the anxiety they feel about it. An example is entering and staying in a school assembly. Pupils can scale this using a scale or a pictorial representation of this, for example a ladder. With the ladder, graded small steps are identified from easiest to most challenging to work towards achieving their goal. With the assembly, for example, the first step might be to watch a video of an assembly, and a later step might be to stand outside the assembly. Some resources for interventions that use a CBT approach. CBT-based resources for children and young people are readily available, including free downloadable worksheet packs and inexpensive books, which can structure school-based intervention sessions, including the following texts. Anxiety management interventions. There are a wide range of exercises which can be taught to pupils who find it difficult to cope with and self-regulate their anxious thoughts, feelings and behaviours. These include the following exercises and techniques. Mindfulness, visualization, relaxation, breathing, distraction, grounding, and journaling. Social skills interventions. If the pupil at risk of EBSA presents with social communication and interaction differences or is autistic, they will probably benefit from accessing social skills interventions. There are many structured programs available, for example the Talk About series and Friends series. The aim of a social skills intervention is to teach pupils about the social skills they may find difficult, for example, initiating and sustaining conversations, listening and responding, sliding in and out of groups, assertiveness and social problem solving, and body language and social cues. These interventions typically involve role play, storytelling, discussion, watching videos, and playing games. This is the end of this video. Part 3 on this topic is now available to watch. You can view more videos on this channel in the EBSA Essentials series.